Good morning, friends. Today we are going to discuss about a remedy. But before that, I would like to wish everyone happy Teachers' Day. And I express my sincere gratitude for all our teachers. In today's session, it is more in a discussion form where we are discussing a remedy and we are discussing a new approach, which is synthetic approach. A lot of people feel that synthetic remedies are, we cannot take synthetic approach because the remedy is entirely different, but still we do get to see shades of both the compounds or both the elements in the compound. So we will try to see how it can help us in clinical practice to become more precise, or at least give us a hint that we should think about some other remedy rather than trying to fit everything into a remedy which may not be covering everything. So I will invite Aditi to share her case and how she solved this case. Yes, Aditi, you can start.
Yeah, thank you, Anita. I'm narrating a case. This is a case of a 28-year-old female when she had come to me 2 years back. And it's a case of PCOS and obesity. And she has been having a menstrual irregularity right from the menarche. Only for 2-3 years at the beginning of the menarche, her periods came regular. And after that, it started becoming irregular. And then practically amenorrheas for years together. And she would get periods only after taking OC pills. And this history was going on since the age of 16 years, and she had come to visited me around 28 years of age. So around 12 years this was going on. And she had other symptoms of acne and irritability before periods, and a lot of dysmenorrhea whenever the menses is coming. And she would have loose motions, nausea during periods, leukorrhea after periods, and a lot of hair fall also, and obesity, of course, weight gain plus, and even hirsutism. And she also had lot of headache issues, which was coming up with a loss of sleep, and whenever she would wash her hair, and even the cold air would aggravate her headache problems. And she also had issues of dandruff, lot of dandruff in the frontal region of the scalp, as well as occipital region. Now then, when inquiring about her life space and all, I felt she had one brother who is 34 years, and presently mother, she and brother. And she lost her father just 2 months before she visited me for the first time. He passed away in COVID complications in the hospital. Then I inquired about her stresses of the life and all. So she said that I always want, how do I support my family? And so I said, is it because now the dad has passed away, this is the thought process? She said, no, it has always been like this. When I was in 11th 12th standard, my dad's business was good, everything was fine, but still I would always feel that how do I still bring up the standard of living of the family, and how do I support father, how do I reduce his stress in managing the life. And now the presently the stress is, how do I manage my mommy, because my mother is very grief stricken, very broken. So now that responsibility also I felt a financial responsibility. So this is what she was talking about. Then further inquiring, like she was telling me that I had a very great bond with my father. And I felt that why was I not there with him when he was in the hospital? It would have made some difference. I don't know. I feel that way. I was very close to my father. About her nature and all, she has been an introvert person. She doesn't express that much. With that, She also has lot of anticipatory anxiety during exams. She would tell she used to have lot of anxieties before certain subjects exams. She would fall sick. She would develop lot of diarrheas and all these things before exams, anticipations and all. And but simultaneously with this anxiety, there was another feature in her where she said, emotionally I am not dependent on anyone, I'm independent by nature, I can take my decisions when the time comes, when it is needed to take a decision. And then because this problem had not developed after father's death, so I had gone much in the past, since her menarche time and all, to understand her more as a person. So I said, what had happened that time? So she said that I always wanted to go out of a house in another city and wanted to experience living alone without my mother. I wanted to have that feeling how to live without mother. So that also came very prominently in her talks. And I said, what else, like why you wanted to go out, and why, what being a girl means what to you? Because generally we feel that PCOD cases, so always there is some conflicts being a girl, or so I just asked her, being a girl means what to you? And she said, restrictions, why I am not allowed to go out at nights and partying. I know my responsibilities. I'm very mature person. I'm not going to do anything which will demean my family values or anything. And after marriage, there is change of name, surname, houses. I always felt that why being a girl you have to. And so this was the thing. And I also found while talking to her, she is very mature, very poised talking, very mature way of talking, being a 28-year-old girl, and taking lot of always came with her mother, but simultaneously telling me everything properly about mother's illnesses and mother's I could constantly feel that responsibility in her, and very mature way of talking. And brother, though elder to her, but not taking any kind of responsibility, not bothered kind of a person. So this is what I felt in her case. Now, when I was analyzing her case, I felt that one side I saw that she is like, she has anxiety. And also, one more thing she told me while telling about her work experience. So, she was telling me in the office also, I would always feel that people should not laugh at me, people should not comment on me. I said, why would you feel that? She said, I don't know. I would do my work very well, everything good. But still, that feeling was always there. That anxiety was always there. The features of Natrum, very tagged along with mother. Why she wanted to go out and feel the life without mother. The reason was how to live without mother. So somewhere she was feeling that dependency on mother, that she is emotionally dependent on mother. Though she was saying that emotionally she is independent. So I analyzed that emotional independent of her was taking responsibility. There I felt that is there where she is independent, but she was somewhere mother dependent emotionally, and that is why she wanted to go out and experience. So that, and again, that gender differentiation was giving her that feeling and all. So out and out, this case was like Natrum Muir. I was feeling very, very close, because she had come to me in her grief period. I saw her in her grief period, but she was so poised. I could feel tremendous grief in her eyes, but she would never cry. The eyes will water. Eyes will fill up with water, but the tears will not roll down. She would keep herself so strong, always coming with mother and all. So I felt very strong Natrum Muir in her. But then just Natramur was not feeling, I was not feeling enough because I could not feel that sense of responsibility, that taking responsibility. And responsibility at what level? Of the family, finances, and right at the age of 17, when they were quite well-to-do people. They are very well-to-do people. So it was not something that still to bring up the standard to how to shoulder father's responsibility. So her words, so all these things led me to think about a Aurum kind of person. Aurum nephroneticum. Now her pathology was also supporting very strongly to Aurum nephroneticum, the way the ovarian pathology, and it was quite grave. Like since the age of 16, 15, 16, she started getting this problem, and she had visited me at the age of 28. So in the last 28 years, she had hardly got periods, and that also only with the help of OC pills. So practically her hormone depression was very severe. And when I investigated her, it was an insulin dependent PCOS, I found out, because her testosterone level and other levels were normal, near normal. So these made me think about prescribing her Aurum nephroneticum. And when I prescribed her Aurum nephroneticum, she started getting periods after 15, 16 days. She got her first period after many months of amenorrhea. And then till date, continuously, I have 11 months follow-up, and every month she has got her periods in 28 or 30 days. Her flow is also improving slowly, and her hirsutism has reduced little bit, and even obesity. She has lost quite a good amount of weight also. So this is my experience of Aurum nephroneticum. It was a kind of a synthetic prescription for me, taking Natramur and Aurum elements together, and I prescribed it along with the ovarian pathology, female genitals, where we see Aurum nephroneticum has a very strong affinity. So this is my experience about Aurum nephroneticum. Yeah. So
Aditi, I also had one case,
yeah.
This is also a girl who is in her late 30s. She's unmarried, and she also had this responsibility aspect because her father had lost job when she was 10 years old. She had a younger sister, 7 years younger to her. Means that time younger sister was just 3 years old, and her mother used to do odd jobs like selling jewelry, and she used to run this matchmaking service, like she used to do that matrimonial service. So her earning was not that much. But this girl, she was very bright. Though she was fat and she was short, not that good looking, average looking, but she was very good at studies. She was very good at all extracurricular activities. She was liked by all her teachers. But she did not have any close friends because being fat, people used to avoid her. So that time she used to feel hurt that मोटे लोगों को जीने का अधिकार नहीं है क्या? मोटा होना क्या मेरी गलती है? So that type of feeling she used to have. And gradually, when she took education, she started working from her 10th standard onwards. So after clearing 10th, 12th, she did her graduation. She wanted to appear for IAS. So she had requested her parents that at least for 1 year you take care, so that I give IAS and then our family will be, some at a different level altogether. But then unfortunately, parents did not support her, that without your earning for 1 whole year, we cannot manage. So she couldn't appear for IAS. She took up job, very good in her profession, very appreciated, and she had this capacity. She said that seniors also take my advice. And she was a very tough taskmaster with her team. She was quite, dictatorial, and she had this ego. She felt that she is best, she is being, undervalued. But then she deserves much better. So this was her professional and intellectual attainments. But apart from this, like being fat and short, she was not getting any alliance. So though mother was running a matchmaking service, she did not put in any extra effort saying that वैसे भी तेरे को क्या लड़का मिलने वाला है. So father did not take responsibility. Mother did not take responsibility. She had to fend for herself. She herself, took care of her own education. She ran the household. She took care of a younger sister. She even sent her sister for further education to foreign country. So that sister had a lot of gratitude for her, but parents never appreciated her. So this girl, like she used to feel she was very unlucky about love. So though she had one relationship, but that boy rejected her on a very, petty excuse that you are vegetarian. So she was extremely hurt. She went into depression. Then she was on tranquilizers, antidepressants, and she used to feel rejected. Rejection was there, that grief was there, that she never had any good friend. And even in love life, she was not fortunate. So again, she had one more proposal where she had met someone on matrimonial site. They chatted for long hours. For a long period, that relationship continued. But then again, he suddenly, he stopped talking. He stopped communicating, saying that you are oversensitive and we cannot get along. Saying this, he just cut off, So this was again a, major trauma. So she had been through all these traumas, and she would always get this feeling, if when I'm fat, what people must be thinking. Being from IT industry, I work from home. I don't get any physical activity. But my relatives feel as if, तेरा क्या है, तेरा तो अच्छा ही है, घर से बैठ के काम करती है और मोटी होते जा रही. So she used to feel that I am a senior manager. I have a very good package. I perform very well. My career graph is good. But still, people feel that being fat, I'm lazy, I'm not doing anything. So that feeling used to, elements from being scorned. That thing was, there in her heart. So that was there. And then she gathered herself, she was on hormonal treatment. She also suffered from PCOD. So she was on hormonal treatment, and because of hormonal treatment, she was having other complaints like acidity and all that. So she decided to shift to homeopathy. So that is how she had come to me. So here you see this unusual responsibility. At the age of 10, she has taken up the responsibility. In your case, there was no need. Still, that patient had that sense of responsibility. In my case, it was put on her. She had no other choice. She had to take up the responsibility. And she really did well for herself. And then finally, she stopped her antidepressants. She joined some spiritual organization, and she was very fond of music. So she took to music, which, helped her to heal. So this was the case. Now we can also get, different shades. I think Shobha also has one case of autoimmune nephronatum. She will share another shade of autoimmune nephronatum.
Yes, friends. And then it is like, when we see that every remedy has a different shades. And when we try to learn these different shades of every remedy, that is the time we complete the totality and we understand the remedy in the totality. So now if I share my case, like it was a case of a 18-year-old girl, and she also was a case of a PCOD. And like in her family setup, she was living with her grandparents' parents and her uncle. So she was very close to her grandparents. And since the childhood, both her father and mother both were working. Their mother was also a working woman. So she hardly used to meet. And this patient was the only child of her parents. So she was taken all the care by her grandmother, starting from her childhood, from her school, as well as her food, as well as everything, her studies, her play, her friends, everything her grandparents knew. And she was very open to share everything with grandparents very openly. So at the same time, grandparents were very affectionate and they used to take care of her very affectionately. Whereas the patient's mother was little harsh by nature. So, but initially when the patient was with the grandparents more and the mother was working, that time patient's contact with the mother was for a very short period. After that, what happened was that her grandfather expired first, but still her grandmother was there. So when grandfather expired, the patient felt that it was a bit shock for the patient. He was sad for that, but then she could reconcile because grandmother was there and grandmother still took care of her. So she did not feel that loss to a great extent. But after her grandmother expired, what happened was that she felt extremely lonely. And she was like, almost she was silently weeping, that because mother and father both were going on work, and it was only the grandmother who had expired. So only patient used to be mostly alone, staying alone at home, and she used to feel very lonely. So what happened is after grandmother's death, she developed amenorrhea. For 6 months, she did not get her periods for 6 months. And when she came to me, like, I was thinking, what has happened? Why have you not got the period for 6 months? So when I tried to talk to her that what was the stress, what has happened? So that time she told me that it is after, when I tried to correlate, it was after her grandmother's death that she was, her period had stopped. So when I tried to understand her relationship with her grandmother, what I understood is when I asked her, how was your relation with your grandmother? Was you very much attached? And she said, my relation with my grandparents were awesome. And how is it with your mother or with your parents? And that she said, it is okay, like it is good. So from what patient is telling us, we can definitely understand that what is the level of attachment and level of detachment with the parents and with the grandparents. And she also said that she was like, मैं मेरे दादा दादी की बहुत ही लाडली थी, like that much attachment she had, and the grandparents were very loving and caring also. So in her case, what I felt that, the role of how we see a role and a symbol of mother, that mother is a person who is very loving, caring, nurturing, and affectionate towards the child. Whereas in this case, for the patient, all this symbol of, love, care, nurture, affectionate was her grandmother and not her mother. And that is why her grandmother was equivalent to her mother. And she was literally grieving after her grandmother's death, as if her mother has died, and she was literally missing her grandmother very much. So this was the time that she developed this pathology of, when we did her sonography, then she had a huge endometriotic hemorrhagic chocolate cyst of left ovary. And that too of the size of 6.4 by 6 by 5.4 centimeters. So huge, it was almost like a size of a coconut. That huge chocolate cyst was there. She was referred to a gynecologist. She went to her family physician doctor, and then she went to the gynecologist, and they told her to get hospitalized and undergo an emergency surgery. But somehow, one thing was the patient's family was not much affording, and they were literally scared of her undergoing surgery. So they came to homeopathy. They came to us, and they showed their desire to take the homeopathic treatment. So that time, while understanding this, what we understood that the whole thing has arisen out of death of her grandmother, to whom, like, she thought it was a death of her mother. The grandmother to whom she was thinking that who was an equivalent figure to her mother. And there were two rubrics that we took at that time. One was delusion that her mother is dead, and another was ailments from death of a mother, death of loved ones, death of mother. So when you take these two rubrics, the remedy which is covering both the rubrics is the only single remedy which is coming up is Auramur Natronatum. So we did her sonography. After sonography, also her MRI pelvis was done, and that was done on 24th March. After that, On 25th, I think her report came. She came to me on 26th with the report. And on 26th, we gave her 1 dose of Auramur Natronatum, 30 single dose. And that she had this amenorrhea, which was lasting for 6 months. And she got her periods just 3 days after giving Auramur Natronatum 30 single dose. On 29th, she started bleeding and she started getting a profuse menses with clots for almost 7 days that she bled profusely. But it was a relieving the menstrual cycle, which had happened to her. So, friends, what I felt in this case was that, what was there, that why she suffered from this PCOD. So the one thing was, I felt that it was a very stressful event for her, that the grandmother's death was a very stressful event for her. And she felt that, that was the time she was into a lot of grief and she was weeping silently. She grieved also silently. And what I felt that even her uterus also bled and cried silently, and it bled inside the ovaries instead of taking a normal menstrual flow. So, and that is how she developed a huge hemorrhagic chocolate cyst of the left ovary. Now, if we see the left ovary, why the left side? So metaphorically, if we understand also, again, the conflict develops when there is any conflict with the loved ones or the blood relations, you get pathology on the left side. So that is how the patient, she got the hemorrhagic cyst on the left side. If there is a conflict with any spouse, work or society, usually we see the pathology on the right side. At the same time, the depth of the, if we see the depth of the conflict also, it was very deep in her, like, she felt very deeply. She grieved over the grandmother's death and she literally felt very lonely and lonely. So that is how the pathology which had developed also was quite severe at the level of a huge, this hemorrhagic cyst developed. And that is what is, again, if you see miasmatically, it is a psychosyphilitic miasm. So, friends, what this remedy or this case which is covering up is the death of mother, missing mother, the mother or the motherly figure, grandmother, then silent grief, the loneliness, pathology at the level of the female reproductive system, which is again like she developed a PCOD, and when she was developing this PCOD, during that time, her hairy growth also had increased, on her body. What had happened is she developed this. So that is the masculine features, what we see, because the testosterone had gone higher up, and the left-sided pathology, which is the conflict with the mother. So when we try to correlate all these things, that is the time then we understand that what was coming up is Auramur Natronatum, which is covering all these things, including the 2 keynote rubrics. So that is how I had prescribed this Auramur Natronatum. And when we again got the sonography done, this chocolate cyst had completely resolved. And I found that, that the blood which had accumulated in the ovaries, which had gone into an abnormal path, it got a normal path and it was channelized through a vagina, meaning through a normal menstrual cycle. That is what I felt. When we gave the similimum, the normal this thing happened. Yes, Kushala. So this, can you talk something about the periodic table, where the aurum, the natrum and the chloride is located and how they are related to each other? Can you throw some light?
Yes, surely. I would also like to show the periodic table here. So if we see the periodic table, whatever I've highlighted, aurum falls in row 6 and the 11th column. Natrum falls in row 3, the first column. Chloride falls in row 3, the 17th column. So what we can see in this is, when we talk about row 6, what we talk about is about high responsibility. Somebody who's taking responsibility of tasks which are beyond him, It's unusual, it's beyond him, it's almost as good as impossible. So, and he's taking responsibility of a larger group, either his entire family or his entire organization. So, with such high responsibility comes the power also, and the position also, the leadership also. And he works really hard to maintain that position. So, with this responsibility and this position comes the ego, the honor, and that his ego, his honor, his position is maintained. So in Aurum, you will see features of responsibility unusual aggravates, because something which is beyond him is something which he takes up and he feels very much when he neglects his duty. While we saw Natrum, which was in row 3 and first column. So row 3, we have, it's all about nourishment. It's all about care. It's all about the development of the identity. Now, Natrum is an element which seeks relationship of complete dependence and complete trust from the person. That Natrum is completely dependent. The structure has come into existence, but it has not formed its identity. So his identity is from a person on whom he seeks that care and nourishment. So you'll see a lot of confusion of identity in this Natrum element, as if the identity is not of his. And the Muriaticum also falls in, row 3, but column 17. Now, column 17 is a stage where the structure is crumbling down. It's all dissolving. So in Muriaticum element, you will see that they are totally disappointed. They are betrayed. They feel let down because that person on whom they were seeking that type of nourishment, dependency, and that type of nourishment, care, dependency, relationship has sort of betrayed him. He's let him down. So they feel extremely alone and they feel extremely forsaken. So when you combine these salts, chloride and Aurum, you will see that what the main theme the theme is that they have to take up high responsibility of something which is beyond them, and they do it with full justice, with full sense of duty and conscience. And on the other side, they feel very let down, very betrayed by the person on whom they seek that type of dependence and nourishment. And being an Aurum, he's very hard, he's toughened, and that's a cover-up, because inside him, he's very hurt, but he will not show his emotions. So you'll see a lot of smiling grief behind a very hard, toughened personality, but the pathologies you will find are extremely destructive. So it is psychosyphilitic. So this mixture you will see in all the 3 cases, which even Dr. Aditi, Dr. Anita, and Dr. Shobha shared. So I think, Nirupama, can you give it a PM angle also?
Yeah, sure. As you said about the Natrum Mur, third row. So it's a row of infancy. Like it is also called as extended womb stage. Like now baby is in your arm and mother is 24/7 taking care of this baby. So this baby is used to unconditional love, care, protection. He wants everything. So what happens? Natrum being on left side of third row is very clingy, lovey-dovey type of personality. And chloride, which is extreme right of the third row, feels betrayed. Mother is not available. Mother is not trustworthy. I'm not getting that love and connection. So delusion, mother is dead, is the rubric of Muriaticum. And this Natrum Mur, when combines with Aurum, which is 6th row, a mature adult stage, a king series, what will happen? A very strong, responsible Aurum will not allow this Natrum to express himself. The all needs of infancy get suppressed by Aurum. But whatever is suppressed will come back with vengeance. And aurum, being a syphilitic miasm, the expression of suppression will be a syphilitic. Utero-ovarian axis will get affected. And what happens? Like aurum is on the 6th row. It is equivalent to 6th subclass of the plant. What happens here? Feminine is very strongly suppressed and masculine is shown. I'm a responsible king. So there is no place for emotions here. And what happens? These emotions are expressed through weeping uterus, a bleeding, hemorrhages, clotted. So all this is aurum mur naturam, which is psychotic for pretty long time, suddenly get expressed in the syphilitic way. And this is the expression of the suppressed feminine energy. That is what I have understood about the aurum mur naturam. So Anita, if you can explain us differentiation between aurum mur naturam and aurum mur.
See, surprisingly, aurum mur netronatum is psychosyphilitic and aurum mur is tubercular. So aurum mur, you see lot of passion, and when they are disappointed, they form a very, very strong bond with their partner. And when they are, they go through the hurt or disappointment because they give everything in that relationship, they directly suffer from emaciation. They go into developing tuberculosis. So you have a lot of tubercular qualities in that. There is cheerfulness, alternating with sadness. Again, being aurum, they hide their emotions. They show that they are tough, but they suffer inside. And at the same time, on one side, they will deny the disease. They brood on their conditions. And there is a single remedy rubric that anxiety about disease, and they brood over it, and that aggravates them. And they are hypochondriac on the other side.
Oh.
But if somebody talks about their illness, they get irritated. So they don't want anybody to discuss their disease. That is one aspect. Then about the relationship also, they are very, very passionate. So they have very, very strong bond with their partner. And being aurum and mur, again, you have explained on the basis of periodic table also. So they are very tough. They take up large chunk of responsibility. And in the process, what happens to their personal life or family life? So this is another shade of aurum mur, that aurum mur mother is a big manager holding a very big post and neglecting her own child. So they have also shown, queen mother. So queen mother has to think about the whole kingdom. Everybody is their child. But in the process, what happens to their own child? So in Bahubali also you see, that mother is so strong. But what happens to her own children? They are neglected. So that is one shade. And this is, and they are very much better by open air. Whenever they have all these issues, they want to go out in open air, which really ameliorates them. So these are very, very typical, characteristic tubercular features of aurum mur, which is very, very different from aurum mur natronatum, because natrum element adds psychotic. Natrum mur is very psychotic because of brooding, dwelling upon same things. There is a lot of edema, water retention. So you see a lot of psychotic features in natrum. But aurum mur is a tubercular remedy. That is one very interesting aspect.
So miasms are so important to understand any
Yes.
remedy, right?
So we
So
have
to
to take a
understand
holistic view
so
of the
miasms
case,
are
of the remedies, because if you take a holistic view, then your prescriptions becomes more and more precise. Like in Aditi's case, if she would have missed aurum mur natronatum and stuck to natrum, then there wouldn't have been such good result. For 11 months regular periods is a good achievement.
Very good achievement.
Even Shobha's case, it was a beautiful response. In my case also, periods started becoming regular.
So, Anita, the female reproductive system is a major sphere of action of Aurum Mur Natronatum. If we see like in the literature.
And that Nirupama also said, no, because of masculinity, your femininity is being suppressed.
Yes.
So all these remedies, they want to, in PCOD, whichever remedy has that sphere of action, all these remedies, they try to show that they are very tough. But within their heart, they are very vulnerable. Emotions are there. They are afraid of getting hurt. So it is sometimes said, like PCOD, there is a bubble pack on the ovaries. So which is, protecting their vulnerability. Vulnerability of femininity. So there is a lot of suppression of femininity, and this is how so many cases of PCOD are increasing nowadays, because females also have to step out. They have to work with in male dominated areas also, and they have to take up this type of role also of being provider or managing finances, which are actually masculine qualities.
At the same time, Anita, another thought also come in my mind constantly, that nowadays the kind of role merger is happening between a male and female, between the two partners. So we will start seeing Aurum Mur Natronatum even in male cases, in testicular pathologies, in prostate pathologies, because now the roles are getting merged. So as we are seeing PCOS and all more in females, we are also going to see now the males of very low sperm count because of the testicular stress, and even prostatitis and prostate pathologies, prostate enlargements, where Aurum Mur Natronatum can come. And I think we have to widen our horizon, and we have to be more vigilant even to search for Aurum Mur Natronatum even in male patients.
Very true.
Aditi, one doctor had told me that Aurum Mur Natronatum, when we are talking about unusual responsibility. So there you can see, people going through divorce, or a mother suddenly dies and father has to, shoulder all the responsibility. They have to play the role of mother as well as father. So in that case, when you're talking about, males suffering from pathologies, for them, it is very unusual responsibility. So they have to, balance masculinity with femininity. So again, in that case, also unusual responsibility. So we have to understand, what is unusual responsibility. So in Aditi's case, we saw unusual responsibility, daughter taking care of the mother. So in Aurum Mur Natronatum cases, in my case, you saw the mother neglecting. There was total neglect from both the parents, and girl had to fend for herself. She had to not just take up her own responsibility, but the whole family's responsibility she had to shoulder. In Shobha's case also, mother was, not there, and grandmother who had taken her place. So there are different types of, and in that case, it was rather than not unusual responsibility, but mother, which grandmother took the role of mother. So it was death of mother or delusion, mother is dead. So we have to see this mother relationship also in Aurum Mur Natronatum. Anything else anybody would like to add?
God.